Hello and welcome to the Kinship Carers Online Trauma Overview video. In this module, you will gain a basic understanding of the different types of trauma and how they might relate to the experience of the child in your care. There are multiple meanings of trauma, including medical, physical or psychological injury. Traumatic events are quite common and can happen to anyone. They can take the form of accidents, assaults, violence, war, and natural disasters. Most people will experience a traumatic event at some stage in their lives. In our society today, trauma is becoming an overused word which relates to any stressful situation. In reality, trauma relates to incidents which are outside the range of normal experience and during which there is a serious threat to the person's survival. Trauma does not refer to the event itself, but rather the impact the event has had on the person. Trauma is the experience that something is so overwhelming that it impacts on the person's ability to cope. Because it is unbearable and intolerable, it impacts on a person's ability to function. Type 1 trauma is also known as single incident trauma. This includes events such as natural disaster, terrorist attack, serious accident, or street crime. Type 2 trauma, or complex trauma, refers to the impact of repeated traumatic events such as community violence or war, or repeated abuse and violence that occurs within a relationship. Family violence, sexual assault and incest, and child abuse within the home are all examples of complex traumatic events. The impact of these events is complex because they involve a breach of trust, and this impacts on the person's ability to trust in other relationships. Complex trauma is usually repeated over a period of time, which increases the complexity of its impacts, compromising the psychological, social, and emotional parts of development, particularly in small children. Developmental trauma is complex trauma that happens to a child. It is called developmental trauma because the events impact on the way that the child's brain and body develops. Developmental trauma often involves exposure to family violence or the abuse or neglect of a child. Often the terms complex trauma and developmental trauma are used interchangeably to describe the same thing. What is important to remember is that trauma that occurs within relationship creates serious deficits in a child's ability to trust adults, and it is this breach of trust, alongside the impacts on their physical, psychological, and emotional development, that lead to trauma symptoms which are often evident in children living in out-of-home care. It is important to understand the different types of trauma and the ways in which they impact on a person because they help us to recognise what the potential impact has been. Although a child can have a history of all kinds of trauma, it is developmental trauma that is the most common in kinship care because the child has often had experiences of trauma within their family that led them to coming into your care. As kinship carers, you may not know exactly what your child has experienced before they started living with you. Developmental trauma can start when a child is very young, including before they are born, so they will not necessarily be able to tell you what has happened to them or what they have witnessed. But this does not mean that trauma has not affected them. Trauma changes a child's sense of safety, even if they are too young to remember or to tell you what has happened. You also don't need to know exactly what has happened to a child to be able to support them. Being able to recognise the signs of trauma is enough to guide you in the right direction to support the child toward recovery. Children who have experienced trauma demonstrate difficulties depending on what stage of development they are at and when the trauma was experienced. Understanding the stages of development and the impacts of trauma at each stage can help us to understand what a child needs to recover from that trauma and to continue developing normally. Check out the articles and resources section on this page for more detailed information on trauma and the development of children at each stage. To understand a little more about how trauma affects the body, let's take a look at the brain and how we believe that it works. The brain develops from the bottom up. That means that the bottom of the brain stem, develops first, and then the limbic system, in the middle of the brain, and then the cortex, which is the lumpy bit that covers the top of the brain. Check out the video in the resources section on this page, which shows Dan Siegel explaining a simple way to understand the brain. At each stage of a child's development, the brain is developing from our most basic functions, like breathing, sleeping, thirst and hunger, to more complex functions like managing emotions and thinking and reasoning. When trauma happens to a child, the impacts of the trauma can disrupt the functions that are developing at the time the trauma occurs. For example, a newborn baby has really only developed its most basic functions, so when trauma interrupts these functions, the baby might be difficult to settle for sleep or have feeding problems. For an older child who is developing emotionally, trauma can disrupt their ability to calm themselves down and can increase tantrums and anger. These are just a few examples of how trauma displays itself at different stages. One of the biggest impacts of trauma is the way a child recognises and responds to threats in their safety. There is a special part of the brain that tells our body how to respond to danger. But in a child who has experienced trauma, this part of the brain can become over or undersensitive. So a child might respond to a perfectly safe situation as though they were in danger, or they might engage in behaviours which are dangerous, but they are not able to register any threat. For carers, you might notice that a child is easily startled or frightened. You might notice that a child responds to you as though you are angry or threatening if you raise your voice or change your facial expressions even a little bit. This is because the child has learned to read very subtle signs of threat in order to engage the part of the brain that prepares them to protect themselves, their fight or flight response. More information on the way the brain responds to trauma will be covered in more detail in another module. Trauma affects the whole person. In children, trauma can affect physical health and growth, emotional development, behaviour, attachment and relationships, mood and managing emotions, particularly strong emotions, and their ability to function. Many children who have experienced trauma seem to go backwards. This might mean a child who has been toilet trained starts bedwetting, or a child who is able to go to sleep unassisted might resist going to sleep, or they might need you to stay with them until they fall asleep. They may wake many times during the night, experience nightmares, or become afraid of the dark. A child who once played happily with others might start to cause fights with other children, become aggressive, or they might become scared and clingy and refuse to play with others. All of these reactions to trauma are normal because they illustrate the distress a child is feeling. Their world is no longer safe. Even if the trauma is no longer happening, the effects continue inside their minds, bodies, and emotions. Some of these behaviours and reactions can be frustrating and challenging to deal with, particularly if we don't really know why they are happening. But for carers, it is important to remember that even though we might not like a behaviour or reaction, there is a reason it is happening, and it might be the only way that child has to communicate the distress they are experiencing. Even if you don't know if a child has experienced trauma, any of these behaviours or reactions are a way to communicate for a child. They are not being naughty, willful, or defiant, and remembering this can help us to respond to children in a way that helps them to cope and to feel safe. Caring for a traumatised child is not the same as caring for a child who has not experienced trauma. Traumatised children need additional support and care to help them recover from their trauma experience and to develop normally. There are many ways to support a traumatised child, and many of these will be explored in the modules in greater detail. But for now, here are some simple things you can do to help the child in your care recover from their trauma. For babies, rhythmic and patterned experiences can help to settle and regulate their bodies. Using massage, rocking, and drumming in controlled and rhythmic ways can help babies to regulate and to settle. It is also important that carers are in tune with the baby's needs and respond as quickly as possible so the baby can learn to rely on your availability to comfort, soothe, and meet their needs. Toddlers can benefit from the same strategies as babies: rocking, massage, and drumming, but these can be added to. Small children benefit greatly from interactions with animals, such as horses and dogs. Regular emotionally and physically warm interactions are also important, like cuddles and praise. As children get towards preschool age, activities like role play and exploratory play, knowing you are close by, can help a child to become more comfortable in exploring without feeling unsafe. Play therapy can also be really useful for children at this age. Most of all, predictable routines, a safe and stable environment, and reliability and dependability of carers are the best ways for a child to learn a different experience of safety and coping. For more information on trauma and basic strategies you can use with the child in your care, check out the articles and resources within this module. Or to learn more detailed information about trauma and recovery, check out the other modules on this site. If you would like to test your knowledge on the information presented in this module, try our self-test quiz on this module page. If you have any ideas or would like to provide feedback about this module, please let us know by going to the Contact Us section on the menu. Thanks for watching.